Hello and welcome to Benefit News. You're here with me, Madeline Gore, and we are on Wellness Benefit Podcast. We've been talking for the past few weeks about diabetes and what it means to have diabetes, the various complications that arise from it, what kind of nutrition to go into for that. And yet, we see quite often that when you think of diabetes, the first thing that comes to your mind is sugar. And pretty much it stops there. We don't really look at what else it involves. And as we know, India is the diabetic capital of the world. But did you also know that diabetes is one of the leading causes for heart disease in India? To talk more about this, we've got with us Dr. Jay Shah. He's an interventional cardiologist, and we're so glad to have you on the show.
Thank you.
Thank you for joining us. We'll dive
Pleasure.
right straight in.
Yeah, sure.
Like I mentioned just now, a lot of us don't really link diabetes with heart disease.
Correct.
So how does this work? Can you explain the mechanics of it a little
Yes,
bit?
absolutely. So, diabetes is not a single entity. It is a conglomeration of multiple things. It is called a syndrome. That means you are taking care of liver, pancreas, heart, kidney, brain, peripheral nerves and the vessels, everything, and even eyes. So, diabetes should not be considered as a single entity, number one. Number two, why all these organs are being affected? It is mainly because of this glucose toxicity.
Okay.
And it is mainly because of the insulin resistance, which is there as a part of metabolic syndrome in a diabetic individual. So it is basically a failure of liver and failure of pancreas, where the pancreas is not able to release insulin in proper way, and at the same time glucagon, there is another hormone which is getting released, and that imbalance between these two is basically producing lot of issues with sugar. And how the heart is being affected, it is in form of deposition of cholesterol within the coronary arteries. It produces negative remodeling within the coronary artery. That means the
That
size
is
of the
like
artery
when you have
becomes
salt
small.
water in your pipes.
Correct. It is almost like that. So you are having sugar, that sugar itself will lead to dysfunctional cells in the coronary arteries, which is heart arteries. So it will make the arteries narrow, it will make small and medium size, it will produce a lot of tortuosity, and it will produce deposition of the cholesterol within the arteries at multiple level. So that is known as diffuse disease and multiple skip lesions.
Okay.
And all these things are responsible only because of the uncontrolled diabetes.
Cholesterol you mentioned here, I
Yes.
mean the hardening of your arteries, etc. All of this is very, very, these are the main points that lead to strokes also, right?
Absolutely.
Okay. So the first thing we want to talk about is a lot of people with diabetes don't tend to know when they have heart disease.
Correct.
So, I mean, I've heard of patients where people who have diabetes have had heart attacks and not known it. Is that why, I mean, we have silent heart attacks, right?
Yes, correct. So that is the terminology is known as silent heart attack. And why it is happening? Because in diabetes, on the basis of the duration, it will affect the nervous system. Now this nervous system is basically, in layman language if I tell, it is the perception of pain, which is getting completely diminished or reduced because of the diabetes. And
So-
because of that, patients are not getting a typical of chest pain or angina, what it is there for non-diabetic individuals. They are having some atypical symptoms,
Like?
like they have jaw pain,
Okay.
they might be having pain in the back, then they are having unexplained high pulse rate or a palpitation, then they have an unexplained diaphoresis, that means excessive perspiration.
Okay.
And they might have a postprandial, that means soon after taking some food, they are having some sort of heaviness. So these are some of the atypical symptoms
Okay.
in diabetic individual. They are by and large pertaining to heart disease.
So, a lot of these people don't get the usual, left hand pain and chest
No,
pain.
they might not.
Okay.
It's not that they are not going to get it, but they might not. So you have to be very careful regarding the symptomatology in a diabetic individual.
Can we talk a little bit about macro versus microvascular
Yes.
problems?
Yes. So a very important question. Macrovascular questions means it is involving the major organs, that is heart, second is brain, third is kidney. Microvascular complications means it is affecting the retina and the nephrons within the kidney.
Okay.
So that is known as nephropathy. And the third one is neuropathy. That means the peripheral nervous system is getting affected. So you are feeling either a tingling or a numbness. You do not have a sense of perception. Touch perception is not there.
So is this because, I don't know, I mean I might be wrong here, that because you said sugar is not being the glucose is not being absorbed into the body. So is it like, you have these nerve endings and sugar is getting deposited on that or something?
Yes. So it is getting
So
deposited.
it's like
Not only
putting on a
that.
cap.
Yes, so it will produce lot of glucotoxicity within the vessels, within the cells, within the neurons.
What
All
exactly
this,
is
so glucotoxicity will produce how can I? It's a free radical oxidation which is happening within the cell, which will actually lead to programmed cell death.
Okay.
That means the cells are becoming dysfunctional because of some molecular level changes. There is a substance called as mitochondria. Now that is the substance which is going to give you energy. Now this is getting dysfunctional in diabetes because of the per se glucose dysregulation. So all these things will come into play when we are talking about a cellular level involvement of the diabetic patient.
Then I'm assuming it is very important for diabetics to get regular screenings.
Absolutely.
How regular?
To be very frank, in a diabetic individual, the best thing is to know the numbers. If their fasting sugar is remaining less than 110 and their PPBS, that is postprandial sugar level, ideally should remain around 140 to 160. And their HbA1c, which is a average of 3 months sugar, ideally
That is
should be
the amount of sugar in the hemoglobin, right?
in the hemoglobin, that is HbA1c, it should be less than 6.5.
Okay.
This is called a completely controlled sugar. Ideally, if the patient is taking medicine, then they should get themselves checked for sugar level at least 3 months.
Okay.
Because that is where you will
So
be
you
able
keep
to see
your A1C
in
steady.
check. Absolutely. Because ultimately, another important point what I wanted to hear, emphasize is that when you find out that you are having diabetes, then you need to treat it like a T20. Like the play overs, the power play, first 5 overs. Once you know that you have diabetes, you have to strike very hard. You have to keep it very, very under control. So intensive sugar control is required. If you maintain it for 5 years, you can delay the complication by more than 20 years.
That is fascinating. I've never heard of this
So
before.
this is something, by and large what happens is that in India, in most of the part of India, you get or rather diagnose diabetes after the maybe 3-4 years. You are having diabetes, you do not know because you have never checked yourself. So regular health checkup is very important. And it is not that those who are having family history, those who are having at high stress related job stress or any stressful condition, and those who are having another comorbidity like high blood pressure, obesity, smoking tobacco, or
drinking also, right?
any sort of bad habits, and you are having some sort of weight related issues or obesity, all these things are considered as a comorbidity. You must check yourself for sugar level and your cholesterol.
You mentioned obesity a couple of times actually.
Yeah.
Is there any particular kind of, because you talked about weight.
Yes.
Is there a particular kind of obesity? I think we were talking earlier about visceral fat.
Correct.
So
visceral fat is something which is more pertaining to heart. So whenever there is a deposition of fat in the organs, I'm talking about liver, pancreas, the surrounding part of the heart and all other major organs, that is where it has got a direct correlation with the heart disease. Okay. So what is important is to identify whether the patient is having adiposity, which is visceral or not. Okay. Visceral means organs. Adiposity means fat. So fat deposition, central obesity or abdominal obesity is more commonly associated in Indian patients with heart disease.
Is there a gender disparity in this?
Yes. It's more common in females as compared to males. And there is a study called ICMR India study, which was being published by our Indian Council of Medical Research. It has shown that the maximum prevalence amongst all the metabolic disease in India is through obesity, and that is central obesity or abdominal obesity.
You mentioned controlling sugar for a good 5 years.
Absolutely.
Now, considering we are in India where every other month we have a major festival.
Correct.
So how do patients do that?
So you need to curtail on carbs. You need to be very strict on taking sugary beverages, all these cold drinks and all that. Then also you have to be very careful in taking trans fat. that if I tell you in a layman language, khari biscuit, it's full of trans fat.
It's basically
Don't go for that puffs and
Huh.
that vegetable puff and people are taking it. It's full of trans fat. So these are the things
So,
you must
do you want to
avoid.
quickly explain the difference
Yeah.
between trans fat and the other kinds of fat?
So trans fat is something which is having a maximum chances of creating a cholesterol plaque. And
Okay.
these plaques are getting deposited
So this
within
is
the body.
basically like pipes mein jung lagna.
So jung langna, yes. It's a complete jung.
Huh.
Only thing is that these are the things which will make the plaque very soft. So what you require is to make this plaque more stable. For that you need to take or rather exercise, physical activity, 40 minutes a day, 5 days a week is must. At least 5 days a week it should be done. Another important point is that by looking at the cholesterol level, there are medicines which can take care of these plaques. They are known as statin. Now this statin is nothing but the drugs which will keep your cholesterol plaque under stable condition. It will prevent that plaque to get rupture. So you do not have any sort of major vascular event either in form of stroke or in form of heart attack.
Because if this plaque is loose, then it can go into the brain also, right?
Absolutely.
So-
Now these plaques are ready to get a rupture. Now once it is ruptured, it is like a volcano. So volcano, once it is there, it will conglomerate all the RBCs and the blood cells. At that region, it will produce a large clot, which is a red clot. And that red clot, if it gets fit into that artery, it will produce a attack.
So are diabetics more at risk for say brain
Yes.
aneurysms or deep vein thrombosis?
No, diabetics are more prone to develop heart disease in form of heart attack, followed by stroke. Third thing is heart failure. Regarding DVT, there are so many other factors. Diabetes is one of them. But for DVT, it's more of a dysfunctional venous perforators,
Okay.
which are there in the
So it's
legs.
not
and
really
it's not
plaquing
related
directly.
to yeah.
Okay.
It's more related to vein. I am talking about arteries, and artery is where the diabetes is basically affecting directly.
So how does a patient assess their risk? How do doctors assess risk for
Correct.
patients?
So for assessment and the risk stratification, we get their test done.
Like what kind
Once
of tests?
now these are all basic tests like
Like a ECG.
ECG, echocardiography, treadmill test, and coronary calcium score. So these are the basic non-invasive tests for diabetic individual. If at all some of the test is showing some sort of signaling which can lead to heart problem or which can you are becoming at a high risk of development of heart disease, then we subject them to undergo coronary angiography. And once the angiography is being done, we know that which are the lesions, which are the blocks, which are responsible for producing life-threatening condition. We need to treat those conditions. If at all it is producing a diffuse disease or a small vessel disease and multiple plaques, it can be managed conservatively or medically as well.
Okay.
And if there are blockages which are there in almost all the arteries and they are affecting mainly the proximal part, that means the earlier part of the artery, then it might lead to even bypass surgery as well. So it all depends on what exactly is the angiography picture tells you.
What about CRP levels?
Yes.
What exactly are
So
what
very
what
very
is
important.
CRP?
Yes, very important question. CRP is basically C-reactive protein. It's an inflammatory marker.
Okay.
Now this CRP came into play along with D-dimer during COVID days. Like everyone was getting CRP. It is basically suggesting that whether you are having any sort of inflammatory condition in the body or not. Now for heart, CRP is not important. For heart, HSCRP is more important.
Which is what?
Which is high sensitive C-reactive protein.
Okay.
HS stands for high sensitive.
Okay.
What it does, it will give you the idea about the presence of inflammation within the coronary artery. That means the arteries are being affected by first by cholesterol plaque and second by inflammation.
Swelling.
So by layman language, it is just a swelling. Now that swelling, if the level is remaining between 2 to 5, that shows a presence of swelling within the coronary arteries. But if it is more than 10, you have to think about more causes except heart disease.
So you're telling
when
me
it
that
is
the heart can
very high,
swell when there is no heart
so
disease.
here we are not talking about heart as a structure
I'm
is
talking
getting
about- sorry, the
the
artery.
coronary artery.
Yeah.
The arteries is getting swollen.
Okay.
So if it is the range is between 2 to 5, it is mainly involving heart or coronary arteries. But if it is more than 10,
What about 5 to 10?
5 to 10 is a grey zone, which can be because of some other inflammatory conditions. Say for example, you have a rheumatoid arthritis. you have some collagen disorder or some SLE or something like that, which is involving the chronic inflammatory condition, that can also lead to high CRP level or HSCRP level.
This might sound weird, but if you were to compare a non-diabetic, say, smoker, and a diabetic person who's not been taking care of their sugar levels, who is more likely to get heart disease?
So both are at high risk.
Yeah.
Those who are having uncontrolled diabetes, definitely they are at more high risk. That does not mean that I should,
Go smoke.
go smoke. That is something which none
Yeah.
of the, but because smoking or tobacco in any form is absolutely, it should be abstained. Because abstinence from smoking or tobacco in any form gives you a lot of healthy body and healthy mind. By saying that, many of the people, they are having myth that smoking means lung cancer. But to be very frank, if you are looking at the data, smoking is one of the major cause of heart disease and heart
if you're
attack.
a diabetic who happens
And
to
if
smoke,
you are
then it's worse.
diabetic, then it will lead to plaque rupture at a very young age, where your body or the heart is not prepared to take that insult, and you are having some irregular rhythm in the heart, and you can have a very bad cardiac condition, which can lead to even death.
So now I like this because every doctor that's been coming here, we've all been scaring our public, which is I think important.
Very
because
important
it's
because
very easy to let this slide. Now, this is a societal thing also that we tend to be, हाँ हमारा health बाद में देख लेंगे. We look at elders first or
Exactly.
children first.
Yes.
So I think it's important that our audience is a little bit scared once in a while. So
But here we are not here to scare anyone, but it's more of a,
I would think that you have to scare them just enough to go visit a doctor.
not doctor, at least
Get your test done.
get a test done. Exactly. At least get a test done. If you think that there is something or abnormal is coming, then you approach your
So
doctor.
basically prioritize your own health.
Prioritize, yes, absolutely. Make health as a fashion.
Speaking of which, lifestyle changes.
Absolutely.
So we're talking about you mentioned high carb drinks like sugary drinks, etc. So what about sugar versus like carbs versus fats? Is there a delineation there?
Both are going to, like,
Like, which is
especially if I'm
worse?
talking about diabetes,
Huh.
then I would say that carbs has to be very low as compared to fats. Some of the fats are important. Some of
So
the
healthy fats.
Healthy fats are definitely important. Always try and maintain a good amount of diet which is rich in protein and fibers, like nuts, berries and seeds, or all the proteins like pulses, legumes, everything you can take. Those who are non-vegetarian, they can go for chicken or fish,
Like the
which is
nutritionist
definitely
who was here last week, she was telling us the importance of omega-3s.
omega-3. Yes,
So-
of course.
No,
So nuts, that is what I'm saying. Nuts are basically rich in omega-3 fatty acids. So, but in nuts also, you have to be careful that you have to consume more of almonds and
Then
walnuts and then cashews.
Yeah.
Of course.
So the bigger villain here. So because a lot of people think of fat as bad as a general term.
No.
So like ghee, for instance,
Of
I
course.
think I've read papers that say in a limited quantity. Now the question is that in Indian cooking, generally we don't do limited quantities of anything.
Correct.
So do you think that becomes a pressure point for a lot of Indian people, patients?
What is important is to identify which is a good fat and which is bad. Bad fat means I'm talking about margarine, then this hydrogenated oils.
So you're
So
basically
all
your
these
vanaspati
things are
type things,
vanaspati, and once you are reheating the oil again and again, that is where the maximum deposition happens. So sometimes many of the people, they ask us that which oil is better. The best oil is olive oil, but how can you prepare
can't cook with
you
that.
cannot cook with that. It's very difficult. So any oil in a modest amount or in a moderate amount is more. It's more than enough. It's not that it's not helpful. Ghee is definitely helpful. Homemade sweets like sukhdi or any other sweets are definitely better than having a processed food, having a preservative containing foods. So that is where I think we need to teach and we need to learn.
I might want to come back to this later, but for now, it's not necessary that only obese diabetics get heart attacks, right? Thin
Yeah.
people also get heart attacks.
Absolutely, yes.
So how does that work?
So there is a misnomer or there is a myth that those who are having thin and lean body weight, they are not developing heart attack. Because thin and lean body weight, we do not know the other factors in those conditions. The biggest factor in those conditions could be any other habits, high blood pressure, even inadequate sleep, or a stress factor. All these things come into play or any other condition or comorbidities, which is responsible for producing a lot of heart disease. So you cannot subject this patient just on the basis of the weight. Weight is one of the factors, but that is not the only factor. So you have to see as a comprehensive, evaluation as far as the patient is concerned.
You mentioned sleep.
Yes.
What does sleep have to do with diabetes?
So sleep is being connecting to us at a greater length with almost all the bad or the adverse outcomes, which is like those who are having diabetes and having sleep apnea. There is a condition called sleep apnea. It is nothing but a sleep disorder, which is probably remain unexplored or undetected, and that is where I think we need to pitch in, because this is the condition which can not only invite hypertension or high blood pressure.
Is it cyclical?
It is cyclical. It is definitely, it's a triad. It is known as Pickwick syndrome.
Okay.
So obesity, cardiomegaly means enlargement of the heart, and high blood pressure. And it will lead to abnormal heart rhythm. It will lead to refractory blood pressure. That means your blood pressure is not getting under control even if you take 7-8 medicines. So that is where I think you need to pitch in, and you need to find out whether the patient is having history of snoring, whether there is a daytime sleepiness, whether the lack of concentration in their day-to-day routine life. In the early morning hours, they are having headache. They are having a lot of early morning, waken up issues. In the middle of the night, they are getting up and developing this problem. Then you need to identify with the help of plethysmography.
Is this easily accessible?
Absolutely easily.
Does every hospital have one of these?
Everyone, and now it is probably done portable. I mean, you can do it at home also.
Okay.
So it's not that you need to get admitted to do this test. It can be done at home as well.
Another issue here is stress, right?
Yes.
Now, a lot of patients are told, stress kam karo, without exactly, guiding them as to kaisa kare.
Correct.
So, how do you deal with patients that come in obviously stressed, and plus if you have been diagnosed with a new disease, you're going to be more stressed?
More stress.
So then how does one figure that out?
So first and foremost is for anyone is to accept that condition. That is number one. Half of the stress is going to go away from that. Stress is going to lead to more of an inflammation, sujan, swelling within the arteries. So that is where we need to go ahead with the good yoga or meditation. Now, by saying yoga and meditation does not mean that patients are doing it completely in a proper fashion. So you need to have a complete calm mind. For that you need to have a good sleep as well, and for that you need to have a good teacher who can teach you how to meditate and how to do a yoga. It does help. Apart from that, if you really want to reduce stress, at least have a good physical activity, either in the form of some sports, swimming, jogging, or if nothing happens, simple walking, 40 minutes a day, 5 days a week on a flat surface is more than enough. Listen to some music, or
this podcast,
or sometimes even a dance. At the time of Garba event, that Navaratri, you know that many of the female, they are having these classes and they are doing a lot of activity. We have seen that during those periods, their parameters like heart rate, blood pressure, their sugar level, everything is absolutely under check, and they are getting a better
Garba.
I'm saying dance in any form.
Yeah.
It's a part of exercise.
Of course.
So that is where I think you can relieve your stress.
So any form of physical exercise, and the minimum being walking 40 minutes a day.
Absolutely.
Does mental health therapy, especially mental health, do you ever tell your patients to go seek professional help? Because there is a major taboo in India, especially.
Absolutely.
So
people, they think that this mental is they're combining psychiatry with psychology. Both are different. Here we are talking about a positive counseling. Here we are talking about a psychotherapy. So that is where I think I strongly believe that those who are having this type of issues, there are a lot of people, they are having excellent understanding of psychology, and they should approach to those people who can give or rather guide us in a better way.
I would assume that support groups also help, not just for the patient but also for family and caretakers.
Absolutely. So a tool which is known as cardiac rehabilitation. Now this cardiac rehabilitation does include cardiologist, cardiac anesthetist, psychologist, nutritionist, dietitians, and physiotherapist. So all these patients, those who are having heart disease, we enroll them in this program. How to go better with your exercise schedule, how to go to take care of your stress by doing a proper structured program where they are having yoga and meditation and everything. So these are the people, they are definitely going to help. And I cannot quote the name, but some of my patients, after doing their angioplasty where the heart is pumping at 30%, and now they are going ahead with the marathons.
Oh, wow.
Just by
That
doing a
sounds fabulous.
proper cardiac rehabilitation.
No, a lot of the time people say, stent laga de to ho gaya, done.
Okay, so it's not like that. You have to have, seeing is believing. Something, when you go ahead with that program, you feel the advantage of that, and then you can spread that, awareness through testimony.
A lot of advances have happened in medication as well, right?
Yes.
I mean, I think right now the newer medicines are the GLP
One
segment.
agonist, yeah. GLP-1 receptor agonist.
So how does that different from your SGLT2, for instance?
So both these molecules are fabulous. I would say that in last 10 years, if some revolutionary has happened in the field of diabetes, ultimately it was being started for diabetes, but it is proven to be extremely beneficial for cardiac disease.
Explain.
So the SGLT2 inhibitor, the program or the trial, it has started for diabetic individual to look for the favorable cardiovascular outcome.
Okay.
But the ultimate goal of the trial was to look for the sugar control level and how this sugar control is going to benefit the patient to prevent hospitalization
Okay.
due to heart failure or heart condition. And ultimately, the recent trial, they have proven that irrespective of the status of diabetes, this molecule,
helpful for your heart.
it's helpful for your heart. It increases your heart efficiency. It increases, or rather strengthen the muscles. It decreases the hospitalization. It improves your survival benefit. And GLP-1 receptor is basically, it is ultimately right now, it's a diabetic drug, but it is an anti-obesity as well.
Because
So-
the GLP is the one that raises insulin production, right?
Correct.
Okay.
So that drug, only thing is that you need to tolerate that medicine. So you have to have a very good knowledge or education how to take that medication. And you go and have a vigilant monitoring, strong follow-up with your doctor, because it is available at 3 milligram, 7 milligram and 14 milligram. Once you achieve a good, maybe 7 milligram, we have seen a weight loss or weight reduction by almost 8 to 9 kg without having any major side effects, and without, or rather with an excellent good control over sugar level, without having any side effects on heart or kidney. So that is what is being there with GLP-1.
Speaking of newer medicines, Ozempic is all over social media.
Correct.
So can you tell us a little bit about that?
So this medicine is going to get launched very soon in India as well. There are MNCs, they are coming up with this. So this is the drug which is ultimately is going to be probably the game changer, because that is where I think this modality will come into play. People are having anti-obesity campaign on the basis of this drug. They are having diabetes control. There is a diabesity, diabetes plus obesity.
Okay.
So all these things are being taken care of this with this drug, and these drugs are also having a beneficial effects on cardiovascular outcomes.
Yes,
So
I read that paper.
that is where I think it is going to completely change the overall scenario how we treat diabetes. and
How
heart
does
disease.
Ozempic work on the human body?
So Ozempic is basically a drug which is acting at the cellular level, and like GLP-1 receptor agonist, it is working at the receptor, and it produces all the beneficial effects on the cellular level,
Okay.
which can control your sugar as in a layman language.
So it controls the absorption of
Absorption of the sugar level.
Okay.
Yes. So
Then,
like SGLT2 inhibitor, what we are talking, it is acting on the nephrons. It is acting through kidney. So there is a receptor mechanism, and that is being affected. I mean, that is being taken care with the help of SGLT2 inhibitor. So SGLT2 is a receptor which is there in the kidney, in the nephrons.
Okay, so it's basically
So it
like coming
produces no. It releases sugar in the urine.
down. Okay.
So when you give SGLT2 inhibitor, extra sugar is being excreted in the urine.
Okay.
So the patients who are
So
having
it-
diabetes, their urine will have more sugar. That does not mean they
So
are having
basically straining it out more.
It is straining it out. So you need to educate all these things to the patient. They should not feel that their sugar is not remain under control and now the urine is also having a sugar. But it is the mechanism of these drugs which is producing more sugar in the urine.
Because a long time ago, I remember older people saying that, if there is more sugar in your urine, that means your sugar levels are high.
High and means you are having a bad control or the kidney is not functioning well. But here the mechanism is such that whatever extra sugar is there, it is excreted through urine. Only thing is that you need to educate the patient that even if your urine sugar comes 3 plus, that means your medicine is working very nicely.
Do patients come to you with these kind of questions?
Yes, absolutely.
Has that improved over the last few years?
Unfortunately, many of the, I should not blame anyone, but many of the pharmacists, they do not know the advantage of this medication, and they are saying directly to the patient that this medicine is causing urine sugar, please stop this. This is a medicine for diabetes and you should not use it. It is producing more sugar. So it's not like that. It is actually beneficial. And this is the drug which is cardioprotective and renoprotective. Reno means kidney
Yes.
protective.
For the longest time, the most basic drug for anything heart related was aspirin.
Correct.
Is it still being prescribed?
Yes. And along with aspirin, statin.
Okay.
One of the wonder drug. All diabetic individual, irrespective of their status, they should take statin. Because the ultimate goal of statin is not to control cholesterol, but to prevent this cholesterol plaque to get rupture.
Okay.
It makes the plaque more stable. So you can withstand any sort of heart problem in a much better way.
Is there any way to come back from cardiac illness? Now, if you've already
No.
had a heart attack, for
Yes.
instance, as a diabetic, you anyway are going to heal slower.
Correct.
So, is there any way for patients to speed up that process or to bolster that?
So that is where this cardiac rehabilitation comes into play.
Okay.
Once you enroll that patient, I am sure that they can get a quality life, come back to normal in 4 weeks.
4 weeks.
4 weeks.
That is a very tall claim.
No. 4 weeks I am talking about those who are being revascularized.
Okay.
That means those who have underwent angioplasty in time. Those who are having poor function, then it might take little longer time.
Okay.
It might take 6 months as well. But once you are absolutely regular with your schedule, I am sure that their ejection fraction or their heart pumping is definitely going to get improved. Because there are a lot of drugs available which are going to improvise on the pumping function, provided the patient is taking it regularly.
What about night shift workers, for instance? Because then your schedule goes for a toss.
Yeah, but
So-
at the same time, they should have a good sleep during daytime because their cycle is now completely different. So, body is having a circadian rhythm. God has given that circadian rhythm. Now it has been completely changed. So, definitely it is going to have certain problems, but at the same time, night shift workers, they have to be very sure. They have to check their regular, that pulse, blood pressure, and sugar and cholesterol. These are the 4 things. They should check it very regularly.
If there's one thing you can tell the audience right now, that immediate action to improve heart health, what would it be?
Know your numbers.
Okay.
Know your heart rate. Ideally, it should be between 60 to 80. Blood pressure should be less than 130 by 80 millimeter of mercury.
Not 120?
Your 130 by 80 millimeter of mercury. It's a new guideline. HbA1c, that is sugar level, ideally should be less than 6.5%. Bad part of the cholesterol, that is LDL, ideally should be less than 70. I stress upon this figure because this is where I think you can prevent most of the problems.
If your LDL is low, you need to have your LDL low and your HDL high, right?
High, correct.
What if one is okay and the other is not?
So you have to work for that. By and large, in Indian patients, we see a lot of low HDL.
Okay.
And LDL will remain in the range of 120 to 150. So
What is the safe range for that?
Safe range for any individual in India for LDL is less than 100.
Okay.
For diabetic is less than 70. For HDL, ideally should be more than 40 in male, more than 50 in female.
Okay.
Those
Why
who
is
are
that?
being
Why do women need more?
Because they are being basically protected by hormones, and for them, so there is another a myth that if I am having high HDL, I am protected. It's not like that.
Your LDL
Your
needs to be
LDL
low.
has to be low, so you need to identify your LDL HDL ratio.
Okay.
If that ratio is remaining less than 2, then you are very much secured.
okay.
You can regress the plaques as well. It definitely helps in preventing the progression, but it helps in regressing the plaques or the blockages as well.
Is there anything else you'd like to tell our audience?
Take a good sleep, do regular exercise, at least 150 minutes a week. That is what is required. Abstain from tobacco in any form. Do check yourself with the help of a regular health checkup. And if you are having a strong family history of heart disease, complete checkup of heart with the help of ECG, echo, treadmill, and sometimes calcium score.
That was very helpful. Thank you for joining us
Thank you
so much. If you have any questions, leave us a comment. If you like this, share it with your friends. If you think somebody can benefit from this, share it again. You know what to do. Subscribe, share, follow, and I'll see you next time. I'm Madeline Gore, and this is Benefit News.